I'm joined today for our weekly COVID-19 update by Dr. Lawrence Loh, our Medical Officer of Health, Paul Morrison, our Director of Bylaw and Commissioner of Legislative Services, and Councillor Paul Visante. I want to start off by acknowledging today it's the National Day of Mourning. It's a day we remember those who face workplace tragedies and collectively remember and mourn the loss of workplace fatalities and recommit ourselves to doing everything we can to prevent workplace injury or fatalities. And it's particularly relevant this year given COVID-19 because so many of our frontline workers have faced extreme danger. And I'd be remiss not to mention with Brampton Transit. It was only a short time ago that we lost a Brampton transit operator to COVID. So the dangers are real, and the City of Brampton will be taking a moment of silence today at our City Council meeting, as will Brampton Transit, to acknowledge the National Day of Mourning. I also want to mention today that this has been a tough week. The loss of a 13-year-old was very tough on our community, the youngest victim of COVID in Ontario, and our hearts go out to the Vegas family. Words don't do justice to the loss that they're going to face, and the reality is that's the risk that's out there right now. When essential workers go to work, the risk is COVID can be contracted. That when we have a stay-at-home order, it's the fact that people from all walks of life can be affected by this insidious virus, and it just really hits home for our community when you see a loss so young. In terms of a vaccine update, the province has announced that we're now opening up the age category for over 45. And this is welcome news because it'll allow us to get more of our population vaccinated. But I would note, as I have been advocating for a long time, we need more vaccine supply to get more segments of our population. And although it's a step forward to have the age threshold lifted to 45, let us not forget the average age of an essential worker in Brampton is 36. So they do not meet that threshold. And they're on the front lines of danger. They're the ones going into these crowded factories every single day. We are starting, though, I should note this, that the province is starting some pop-up clinics with Peel Public Health. There's going to be one starting April 30th until May 11th at the Brampton Islamic Centre, and that pop-up centre is for select postal codes, and it is for 18 plus. I just wish we had several dozen more of those, but at least they are starting. All the details are at peelregion.ca. In terms of a William Osler update, there are currently 107 COVID-19 inpatients at Brampton Civic Hospital, including 14 patients in ICU and another 46 COVID suspect patients awaiting their test results. Yesterday, Osler reached another milestone with 100,000 vaccinations administered. As of today, the hospital has provided 104,000 doses, and that's on top of the vaccinations that Peel Public Health does as well. I should note that when I say the hospital numbers, I say we're at capacity, that is not completely accurate because the hospital has really been dependent now for months on sending patients to other hospitals. So it really is well beyond capacity. We're in a permanent cycle right now where patients have to be sent to hospitals across Southern Ontario, and that's not a sustainable situation to be in. The last thing I wanted to mention before we hear from Dr. Loh is last week, Brampton City Council passed a resolution calling for the cancellation, the closure of all leisure travel at Pearson Airport out of concern that it could have variants enter our community. Peel Region Council also passed this motion, and on Thursday night, the Government of Canada announced they were cancelling direct flights from India and Pakistan. I just want to say that's a half measure. It does not go far enough. If we really want to stop variants from getting into the country, if we really want to protect our community to a greater degree, simply cancelling direct flights from two hot zones doesn't achieve what we're hoping to achieve, which is more security of our border. The airlines can simply rebook all these flights with non-direct flights. And so we're going to continue to have a flow of leisure travel into our country. That puts our region and Canada at risk. And I would encourage the Government of Canada to go that next step and make sure we have a greater level of protection from these variants that could wreak havoc on our healthcare system. We're already at capacity. As I mentioned, we're sending patients to other hospitals. The last thing we can handle is additional pressure, so I hope that gets reconsidered as well. On that note, it's my pleasure to introduce Dr. Lawrence Loh, our Medical Officer of Health.
Good morning. Thank you, Mr. Mayor, Councillor Vicente, colleagues in Brampton. This week, Brampton's test positivity is at 22.2%. Our weekly incidence rate sits at 490 cases per 100,000. It's been a very difficult week, and I wish to extend my deepest condolences to the family and friends navigating the sudden and tragic loss of a 13-year-old child from Brampton. No life lost to COVID-19 is easy, but this one was a very hard reminder of our difficult situation. We've also watched the catastrophe that has gripped India with great concern, and I know that so many in our community have ties there and are deeply worried. The unthinkable suffering observed here and in India serves as a stark reminder of how, without measures to limit contact and mobility, spread can quickly grow out of control. Here in Brampton, our own crisis continues. Though case growth is slowing, we have yet to reach a plateau. We know that more hospitalizations, intensive care stays, and deaths will sadly follow this case rise in the weeks to come. And today, on the National Day of Mourning, our experiences here remind me of one thing. Anything open remains intrinsically vulnerable. And while precautions are critical, precautions are not 100%. Proactively closing many sectors in our community has undoubtedly saved lives. There are some that argue that closed sectors were, quote-unquote, never the source of spread. That's because they were closed before they could become such. The closures and measures taken here, while difficult, have saved lives and prevented the worst-case scenarios unfolding elsewhere. But Peel has also had many workplaces that have remained open throughout this pandemic, with our most vulnerable residents taking their risks on the job, unable to work at home, while keeping the rest of Canada at home and safe. Throughout 3 waves, we have called to protect them with investigations, inspections, and protections. And I'm grateful that working with our provincial partners and the Premier's government, we were able to pursue increased workplace inspections in our region, deploy rapid testing and outbreaks, and I'm hopeful that we can still land effective paid sick leave supports for our residents. Improving vaccine supply is now allowing us to launch a 4th intervention, which is access to vaccination. In expanding our mobile offerings, we have launched workplace clinics this week to vaccinate people who cannot work from home. This initial rollout will comprise of 3 companies, selected by our ministry partners, who will also provide pop-up clinics to serve our community. These mobile clinics build on the 100,000 doses a week that are being delivered in our hospital and mass clinic system at a daily rate that is often the highest per capita rate in the province among large health units. We have now delivered over 500,000 doses. We have now vaccinated nearly 70% of those 60 older in Peel, and we are halfway to herd immunity. But our efforts must continue if we wish to return to normalcy. So on this day of mourning, I ask that we remember our Peel workers who have been sickened or succumbed to this disease and their families, and all of our workers in Peel who cannot work from home and who have taken risks every single day. They need us to stay the course. Besides inspections, investigations, and protections, a consistent and greater supply of vaccine will allow us to continue expanding our mobile offerings while maintaining our mass clinic system and driving age eligibility down until everyone has the opportunity to be vaccinated. Until that day, where staying open is no longer vulnerability. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Loh, and now we'll hear from Councillor Paul Vicente.
Good morning. Between April 19th and April 25th, bylaw officers in the City of Brampton laid 50 charges including 1 charge under the mandatory face covering bylaw and 49 charges under the Reopening Ontario Act. It should be noted that 14 charges are related to a single residential social gathering. 6 charges were related to parking lot gatherings. We also want to remind residents how important it is to respect our bylaw officers who are doing their job. This week, we learned of egregious behavior of residents that threw hot coffee on a bylaw officer simply for doing their job to keep our communities safe. City staff are working hard to keep residents safe. They never deserve to be assaulted or attacked in the course of their duties. We encourage residents to be aware of and follow COVID-19 bylaws and provincial regulations. We also want to highlight that Brampton at this time of year, the flower city, has incredible cherry blossoms along our paths and trails. Please ensure that if you are out to view these natural highlights, that you maintain distancing from those outside your household. Take a look at the City of Brampton social media pages or channels for drone footage of the city's cherry blossoms, as they are a safe alternative to view this natural wonder in the City of Brampton. And with that, back to you, Mayor.
Thank you, Councillor Basante. We're happy to take some questions now. We'll start off with Graham Friss from the Brampton Guardian.
Good morning, guys. How's it going?
Good.
My first question would be for Dr. Lowe. Dr. Lowe, I'm just curious. I know that they've identified some cases in Ontario of the new sort of double mutation variant there. I'm just curious, how many cases have been identified in Peel, if any, and how is this different from previous variants?
Thanks, Graham. Certainly the double mutation has concerns around potential escape from vaccines partially, and also increased severity. As I understand it from our provincial partners, they have identified a number of those variants in Ontario. However, we have not been advised whether any of them are in Peel residents at this point in time. Thanks for the question.
Okay, thanks. My follow-up would be, in the past, I guess there's been people voicing concerns about whether 1 vaccine dose is enough. So with the high hospitalization numbers, I'm just wondering, is Peel Region seeing anybody who has been vaccinated, whether they've just received 1 shot or 2, being admitted to hospital after the fact?
Certainly, Graham, those numbers are all actively being looked at. We do know that 1 shot of the vaccine does prevent almost 100%, and that's all vaccine products that are available in Canada, 100% against severe disease, hospitalization, and death. Almost like 99.9%. It's very effective, and so to the extent that if we want to make sure that we can protect overall hospital and healthcare capacity, getting first doses out fast and continuing, we now have 70% of our 60+ covered, and continue to vaccinate steadily throughout our entire system. I really encourage residents to make sure that if they're eligible, that they do get their shot. Thanks so much for the question.
Okay, our next question is Beatrice from CP24.
Good morning, Mayor and Doctor. I don't know who wants to tackle this one. I'm just outside the Canada Post facility in Mississauga, the Gateway facility, where, as you know, Section 22 order was issued. My question is, in this particular situation, we know that rapid voluntary testing has been happening since the big outbreak in January, but yet in a place so big as this, where there's nearly 5,000 employees, despite the fact that rapid testing is happening, we're still seeing outbreaks. So what more could workplaces and employees do to protect themselves in these kinds of scenarios?
Well, great question, and I'll have Dr. Lowe speak to it as well. I would say the reason Dr. Lowe brought in this extraordinary Section 22 order was because no business is more important. No corporation or business is more important than public health. And I know there's a lot of businesses with significant employment bases that were considered taboo before, that you couldn't close. Well, I think the reality is when you allow an outbreak to continue, it will grow and grow and magnify into the community. And so I know these are difficult choices, but necessary ones. In terms of testing, you can testing's not foolproof, and what we really need is vaccines. We need to vaccinate our essential workers like these Canada Post employees, and as we get more supply, we will be able to vaccinate those essential workers. And as I've stressed for months, there is urgency to this because you can see more unfortunate outbreaks like this occur. Over to Dr. Lowe.
Yeah, thanks for the question, Beatrice. It actually ties in very nicely with my remarks this morning. Again, precautions are critical, and things like rapid testing, screening, distancing, cohorting, these are all things that can be used to reduce risk, but they cannot fully eliminate risk. And I think that really speaks to certainly the vaccines that Mayor Brown mentioned, a consistent and steady supply and an increase in vaccines to our community, which 85% of throughout the region of Peel live within a hotspot as defined by the province, is absolutely critical. I think we continue to see, we continue to have significant capacity throughout our system to be able to get to individuals. We just need that supply and that commitment to be able to get to groups. Certainly the other thing that I know has been talked about significantly, but I feel I must say, because it has been the biggest missing piece of the puzzle throughout the pandemic, is paid sick leave. And it's not just paid sick leave because someone gets sick. Paid sick leave allows people who've been exposed to also stay home. Paid sick leave allows people who need to get tested to stay home. And paid sick leave will also allow people who need to get vaccinated to go and get vaccinated. So I think that has been the missing puzzle throughout this missing piece of the puzzle throughout the pandemic. And I'm very buoyed by some of the conversation at Queen's Park and really hopeful that our provincial partners will be able to support our community on this. Thanks for the question.
Okay, our next question.
Thank you, Dr. Lowe and Mayor Brown. My follow-up, I just kind of missed that element when the gentleman who was speaking about the bylaw enforcement and some of the charges laid was giving some of the data. If I believe I heard correctly that there was 14 people who were charged specifically in one, so-called residential bust. Where did this happen? And I guess how troubling is it that there's still dozens of people potentially gathering in an indoor environment, and could that be prevented by opening or loosening some restrictions on outdoor places?
Well, I absolutely agree we should loosen restrictions on outdoor amenities. That's what the Ontario Science Table has recommended, and I believe we should listen to the science, the data, and the medical advice. Having said that, there's no excuse right now for having social events indoors, and it's why we have significant fines for people that are breaching that provincial emergency regulation. I'll have Paul Morrison, our Director of Bylaw, speak specifically to this incident, but before he does, I just say, I believe 99% of the public is compliant. They take this seriously. They're following the advice of public health, and for the few bad apples, they don't reflect our community. They are an aberration.
Thank you, Mayor Brown. The house party we did attend was, in fact, as I say, a house party, and there are people that are still having these events throughout the city. They're not prevalent, but they're certainly in different areas, and it's not one area of the city. It's spread across in the total city of Brampton. The other event where the officer was assaulted, where the coffee cup was thrown at him, the person he was giving a citation to or a violation to just simply took offense to it and threw a hot cup of coffee at him. Luckily, he wasn't hurt, but and we didn't tolerate it. We contacted Peel Police right away, and Peel Police did subsequently investigate and support charges. So, and we will continue to do that throughout the course of our enforcement activities.
Okay, our next question is for Irene at 680 News.
Good morning. My question is for Dr. Lowe. You mentioned that cases are slowing. We've yet to reach a plateau. How much worse do you expect it to get before it gets better?
Well, thanks so much, Irene. I think we're now getting to the point where we're about 2 or 3 weeks after the spring break and after the significant stay-at-home orders, expansions, and the expansion of the workplace Section 22, which has now been invoked several times in our community. We're at least a few days into that, but a week after the announcement. So I'm hopeful that all these measures have really driven home the seriousness of the context we're in the region of Peel, and that through this week and hopefully into next, we will continue to see the case rise slow and then perhaps a plateau and a decrease on the other side. Thanks for the question.
My follow-up, it's getting warmer, almost May. The province backtracked on the playground closure. Any thought on asking to reopen things like golf courses, tennis courts, to give people something safer to do outside versus a house party? People are starved for doing things. Any thought on maybe asking to have those things reopened?
Absolutely, Irene. We are continuing to revisit and monitor the situation. At this time, however, I think calling for reopening is a bit challenging in my position because, as I've said, we are still not yet out of this very severe third wave. And I think to the degree that we're trying to really get people to understand essential meetings, essential purposes only, and always with precautions, it's a little hard. We're trying to avoid any mixed messaging by saying now's the time to really. So while I recognize that it maybe wouldn't have been my first priority to close, I think a reversal, at least at this point in the third wave, is calling for one, at least from my office, is a little challenged by our current situation. Thanks so much.
Yeah, and Irene, I would add to that. I do hope, aside from the worry over mixed messaging, end of the day, we need to listen to the Ontario Science Table, and they say these are relatively low-risk activities. It's good for people's mental health, physical health. This is tough enough as it is. This is a tough time for our community, and when you take away safe outdoor amenities, it's really it's tough on the community. And I'd go further, create some socioeconomic inequities. So, people who have large homes and have fitness activities, they're fine. But, for those living in crowded living conditions without backyards or living in apartment buildings, they don't have the same access to personal amenities. And it's why we have public places and public spaces for a community to use. And so for me, it gives me pain to see these facilities closed because these public amenities are for the public to keep them healthy, to both physically and mentally. So I do hope that is revisited in a messaging format that is consistent with the need to not socialize with others. Our next question is Sumit Demi from Omni News.
Hi, good morning. Thank you for taking my question. It'll be for Dr. Lowe, please. I'm just wondering, so yesterday we saw the pre-registration open up for the two mosques in Mississauga and Brampton for the hotspot vaccination clinic. The mosque in Mississauga mentioned that their pre-registration filled up in less than 2 hours. I'm wondering now if, as we continue to open up these hotspot vaccination clinics, if maybe different modes of pre-registration or different ways to include workers might be also kind of thought of in this process, because a lot of the workers who are actually working at that time likely did not have the chance to look at their WhatsApp group chats, look at their Twitter, and within 2 hours register. And likely they could have been left behind while everyone who was at home had the chance to register within that short time frame.
So Sumit, I'm really glad you asked this question because it really speaks to the inherent limitations of pop-ups, right? So pop-ups are they are meant to be targeted to specific communities. They have a very small capacity compared to what we are able to do in our mass immunization clinics. And it's for this reason that while we are expanding our pop-ups, we're also expanding, to the extent that you were talking about convenience for workers, our clinic hours. So we are starting to clinics as early as 7 a.m. starting from next week across two of our clinics, Save Max and Paramount, in Mississauga and Brampton. So they'll be offering appointments 7 a.m. till 6 p.m. And then the week after that, we will be going to 7 a.m. till 11 p.m. And that should give plenty of choice and convenience. And our goal is to continue working with the province to really try to drop the age brackets down. We're at 45 now. I'm wondering if we can get to 30 or to 30, 25, in a matter of weeks with greater capacity and greater pieces, which will allow us to make use of the tremendous capacity that exists in our mass immunization clinics already, while we also really try to make sure that these pop-ups are really just for the hardest to reach, the vulnerable, those that really face barriers to get to mass vaccination clinics. What we don't want to see in Peel is we don't want to see situations, as has been in other jurisdictions, where you've got people out the door lining up for 7 hours just to get a vaccination. We have a system that's working now, and our goal is to make sure that that system is used to the maximum capacity possible. Thank you so much.
Got it. Thank you for that info. And as we continue for the pop-ups, I heard yesterday that there's also some talk with the Gurdwara in Brampton. Is there any timeline for future pop-ups? How soon will we see future pop-ups in Brampton?
Okay, I think Dr. Lowe has some good news on that.
Yeah, thank you, Mayor Brown. So there are at least 13 additional community pop-ups, again, in ensuring that those are reaching some of our hardest to reach populations in our diverse community. And we do have our ongoing workplace program together with the Ministry of Health, where additional allocation is being provided to reach those workers, and that will all be a great supplement and build on what we are hoping at 7 to 11 at 2 of our clinics, and hopefully at some point maybe even expanded hours across our entire system will eventually get us to herd immunity. Thanks for the question.
Thank you, Sabrina. Our next question is, it is Sabrina. Sabrina from the Mississauga News.
Hi. Thanks. So my 2 questions would be for Mayor Brown. I just want to hear your thoughts about comments made by Minister Christine Elliott earlier this week, where she said that Brampton has been treated fairly and is getting everything it's entitled to in terms of the COVID-19 response.
Well, I disagree with those comments, but I would say right now we're having encouraging conversations with the province. Christine Elliott herself said she now supports 50% allocation in the hotspots. But the reality is this vaccine rollout, both nationally and provincially, was flawed from the get-go. It wanted to treat every province the same and every city in the province the same. But this virus isn't equitable and fair. It attacks a densely urban area more differently than it would a rural area, or people working in a crowded factory compared to someone working from the luxury of their home. And so when this vaccine rollout started in downtown Toronto and downtown Ottawa, it really mixed the mark on where the front line was. The front line is in places like Brampton, Moulton, Etobicoke, Scarborough, and we need to be sophisticated and targeted and focus on where the fire is. So when I say, the province made some mistakes and the government of Canada made some mistakes, they did. And the proof is in the pudding, a 22% positivity rate. I think there's a recognition now, and I've had some very positive conversations with the Premier, so I think that the sentiment has shifted. But there was not that sentiment at the beginning of the rollout. There wasn't a recognition that essential workers were more vulnerable. There wasn't a focus on some of these suburban, heavily working, essential working communities. And so I believe some of the errors are being corrected, but I don't think anyone would say that mistakes weren't made during the rollout. And unfortunately, it's been at a great cost to the city of Brampton. We've been overwhelmed with COVID cases. We've been overwhelmed in our hospital. We're doing our best to be resilient, and we've got an incredible citizen appetite to support, to help one another, to help neighbors, to help friends, to help family. People are rising to the occasion, but it's been hard, and to dismiss that isn't fair. Is there a follow-up question?
Yeah, so you mentioned that there's sort of a shift now, but I mean, that's a recent update. And so I've been hearing comments from many Brampton residents who believe that the city is still or was not getting enough supplies and vaccine allotment for 2 reasons, either political and political rivalry, or just blatant discrimination. And so I wanted to hear your thoughts or comments on that as well.
Well, certainly we felt in Peel Region we weren't getting our fair share of vaccine supply. At the beginning of the pandemic, I think at one point it was 6% of the provincial vaccine rollout, and when we're 10.5% of the provincial population. Then it grew to 9%, then 10%, and we're hearing in May we're going to have 13% of the supply. So the picture is getting better, but there was a long period there that we were simply and dramatically underrepresented in terms of vaccine supply. And you saw that from everything from the pharmacy rollout to vaccines for the mass vaccination centers. But I can tell you, Mayor Crombie, Mayor Thompson, myself, Dr. Lowe, the heads of our hospitals have been aggressive in advocating for our fair share, and we believe we're getting to a point now where the province recognizes that. Their commitment to have 50% of vaccines for hotspots would make a huge difference. And so, at this point, it's difficult to go backwards. You can only go forwards, and I'm more optimistic of how it looks in the weeks ahead. Our next question is Nikki Cedrone from the Bramptonist.
Good morning. My questions are for Dr. Lowe. Dr. Lowe, with higher rates of infection driven increasingly
by the new variants infecting our youth, will we see Peel Region Health lowering the age to 18 for hotspots like Brampton?
Hi, Nikki. Thank you so much. The age thresholds are controlled by the province, and I'm glad you asked this question because the 18 plus that's out there in popular media, unfortunately, is a bit of a misnomer and moniker. What the province was trying to say, I believe, is that they were going to have mobile hotspot pop-ups, which would serve all comers. So the idea that they could actually just have people, you go to a workplace, you manage to get everyone in the workplace. You go to a community, you get everyone that comes. It was not, I don't believe it was the intention of the provincial government to say that it would be 18 plus online booking for the entire mass clinic system. However, that said, I think we're at 45 now, and as you heard me say earlier in this press conference, we have tremendous capacity, and I understand a lot more supply coming. And so given that we are a hotspot, I am hopeful that we'll be able to work with our ministry partners to drop that age within our mass clinics as quickly as possible. So thank you for the question.
Thank you. And my next question is for you again, Dr. Lowe. Once our schools resume, will you apply workplace closures for schools?
Thanks, Nikki. We've always had automatic dismissal in schools, and so where there is an identified epilink between cases in a school, there has been an automatic dismissal of the affected cohorts, and that was actually the model that we borrowed from for our workplaces. Thanks. I'll pass it back to the mayor.
Okay, well, thank you, Nikki. That exhausts our time today. I wish we could get to more questions, but it is 9:32 and our council meeting just started, so I need to get there. But thank you, Dr. Lowe, for his time, for answering all these questions. To Paul Morrison, our Director of Legislative Services, and to Councillor Paul Vasante. Stay safe. There are better days ahead, and we look forward to talking to everyone again next week.